Welcome back, everyone, to the Deep Dive. Now, today we're taking a close look at something that I know you've all been thinking about as you consider retiring in Bermuda.
Universal healthcare.
Exactly. The Bermuda government's been making, well, a pretty big push for it.
Right.
But is it really feasible? I mean, and what would it even mean for you, like practically? That's what we're going to try to unpack today.
Yeah, definitely a complex issue with, lots of moving parts.
For sure.
But, I think understanding how these universal healthcare systems work in other countries
Yeah.
and, the potential benefits and the pitfalls,
Uh-huh.
I think that can really help inform, your decision about retiring in Bermuda.
Absolutely. So to kind of get a clearer picture of all this, let's look at a country that's actually had universal health care for a while now.
Okay.
Australia. Their Medicare system launched way back in 1984.
Wow.
And it's been both praised and criticized over the years, which I think offers some really valuable lessons for us.
It's a really interesting case study, yeah, because it highlights how even well-intentioned systems can have, unintended consequences.
Right. I actually remember when Medicare first came out in Australia.
Okay.
It was touted as this cheaper, simpler, fairer solution to healthcare.
Mm-hmm.
But then fast forward to today, and it
Yeah.
seems like there's a lot more to the story, right?
Absolutely. One of the big selling points initially was that it would be funded through a simple 1% levy on income.
Right.
This Medicare levy, they call it.
Okay.
However, that levy has since been increased to 2% of your gross taxable income.
So even with universal health care, Australians are still paying a pretty significant amount of their income towards health care.
Yeah, that's right.
So is it at least covering most of their medical expenses then?
Well, that's where things get a little bit tricky. A recent article in the Medical Journal of Australia pointed out some flaws.
Oh, really?
Yeah, some serious flaws in the system. Underfunding has led to, these long wait times for treatment.
Oh, wow.
Exclusions from coverage for certain services,
Yeah.
and even rationing of healthcare resources.
So how does this actually impact individuals, especially someone like our listener who might be considering retirement there?
Well, for starters, it means that they're still out-of-pocket expenses.
Oh, okay.
Medicare doesn't actually cover everything, and so this has actually led to the rise of private health insurance,
Oh, wow.
like Medibank Private.
Mm.
So Australians are now often paying for both the Medicare levy and private insurance.
So even with universal health care, you might still need private insurance to cover the gaps.
Yeah, that's something to consider for sure.
Yeah, that's definitely something to consider. What about specific concerns for retirees then?
Okay.
Like wait times for elective procedures.
Right.
Or coverage for pre-existing conditions.
Those are excellent questions. And the article we mentioned, it actually highlighted some concerns there.
Okay.
For example, certain elective procedures like hip or knee replacements,
Mm-hmm.
they often have very lengthy wait times under Medicare.
Okay.
Yeah. And while those procedures are covered,
Mm-hmm.
the wait can be substantial,
Right.
and that can really impact quality of life, especially for retirees
Yeah.
who may be dealing with mobility issues.
Absolutely.
Okay.
That makes total sense. Now, what about pre-existing conditions? Are those covered under the Australian system?
Generally, yes.
Yeah.
But the level of coverage and the wait times for treatment can vary
Oh, okay.
depending on the condition and the specific healthcare provider.
Right.
So this is where things get a bit murky.
Okay.
And it's important, to kind of dig deeper into the specifics of Bermuda's proposed system to really see how they're planning to address these issues.
Now, comparing a large country like Australia
Right.
to a much smaller nation like Bermuda,
Yeah.
it makes me wonder, are the challenges and the potential pitfalls even greater in a smaller context?
That's a crucial question, and one we'll explore further.
Okay.
The limited resources and smaller population of a place like Bermuda could exacerbate some of the issues we've seen with, the Australian system.
Uh-huh.
I mean, think about it. If Australia is struggling with wait times and specialist shortages,
Yeah.
imagine the potential impact in Bermuda with its much smaller pool of healthcare providers and resources.
That's a really important point. It's not just about implementing a universal healthcare system.
Right.
It's about ensuring it's sustainable
Yes.
and can effectively meet the needs of the population.
Precisely. And that's where understanding the conditions for success becomes crucial.
Okay, so we've seen that even a well-established system like Australia's Medicare, has its limitations.
Uh-huh.
But before we jump into those conditions for success, let's take a closer look at universal healthcare in the context of small nations.
Okay.
It's surprisingly difficult to find detailed information on this.
Yeah.
Which raises some interesting questions.
It does indeed. Why is it so hard to find this information
Yeah.
about smaller nations with, successful universal healthcare systems?
Mm.
Are they simply deeming it infeasible due to limited resources?
Right.
Or are there other factors at play?
Okay.
We'll delve into those questions next.
Yeah, it really makes you wonder, are there just some inherent challenges with implementing universal health care in these smaller nations?
Yeah, it's certainly possible. I mean, smaller nations, they often have limited resources, both financially
Right.
and in terms of specialized healthcare professionals.
Mm-hmm.
And, creating and maintaining a really comprehensive universal healthcare system,
Yeah.
it requires significant investment
Uh-huh.
and expertise,
Mm-hmm.
which can be, a major hurdle for smaller countries.
Yeah, and we saw how even Australia, with its larger population and resources,
Yeah.
has still faced some pretty big challenges with their Medicare system.
Exactly.
It stands to reason that those challenges could be magnified in a smaller nation like Bermuda.
That's a valid point, but I think it's important to also acknowledge that there are some potential advantages
Okay.
to implementing universal healthcare in smaller nations.
Okay, interesting. Like what?
Well, for instance, they often have a much more homogeneous population,
Right.
which can actually simplify healthcare planning and delivery.
That's a good point. A smaller, more unified population
Right.
could mean less disparity in healthcare needs.
Exactly.
Making it easier to kind of tailor a system that works. Right.
Absolutely.
That effectively addresses the specific health challenges of the community.
Exactly.
Okay. I get
And
it.
let's not forget about the potential benefits we were discussing earlier.
Yeah.
Addressing health disparities,
Mhm.
promoting economic efficiency,
Right.
fostering social equity.
Yeah.
I mean, these benefits can be particularly impactful in smaller nations
Uh-huh.
where a well-designed universal healthcare system can really level the playing field
Yeah.
and improve, the overall health and well-being of the entire population.
So it's not a clear-cut case of smaller nation equals automatic failure with universal health care.
Right.
There are some unique challenges for sure, but also some potential advantages that could really make it a viable option.
Precisely. It all comes down to careful planning,
Mhm.
realistic expectations, and really a thorough understanding of both the potential benefits and the potential pitfalls.
Okay, so we've kind of explored the Australian model and touched upon these unique considerations for smaller nations.
Right.
But ultimately, what are the key ingredients that determine whether a universal healthcare system,
Yeah.
regardless of the country's size, will actually succeed?
That's a million-dollar question, isn't it?
Yeah, it is.
Based on the research and case studies we've looked at,
Yeah.
a few key factors consistently emerge
Okay.
as being super crucial for success.
Okay, let's break those down. What's the first ingredient on the list?
First and foremost, a strong foundation of
Mhm.
primary care.
Okay.
That is absolutely essential.
Okay.
A robust primary care system can really help prevent, unnecessary hospitalizations,
Right.
manage chronic conditions effectively, and promote, overall health and well-being.
Yeah.
And this really helps reduce the strain on those more expensive, specialist services
Okay.
and emergency care, which can be particularly beneficial in smaller nations
Yeah.
with limited resources.
So it's about shifting the focus from reactive expensive treatments to
Sure.
proactive preventative care.
Yes.
That makes a lot of sense, especially for someone like our listener
Right.
who's thinking about retirement, right?
Yes.
The healthier you are, the less likely you are to incur those significant healthcare costs down the line.
Exactly. And that brings us to the second key ingredient,
Okay.
effective cost control mechanisms.
Interesting.
This is crucial for ensuring the long-term sustainability of any universal healthcare system,
Yeah.
but particularly vital in smaller nations,
Hmm.
where resources are more limited.
So what kind of cost control mechanisms are we talking about here?
Well, there are several strategies that governments can implement. One common approach is negotiating bulk discounts with pharmaceutical companies to
Right.
try and lower drug prices.
Okay.
Another is establishing clear guidelines for medical procedures and treatments
Uh-huh.
to make sure that they're evidence-based and cost-effective.
Right.
Some countries also utilize co-payments or deductibles
Hmm.
to encourage, responsible healthcare utilization.
So it's a balancing act then, right?
It is.
Between providing this comprehensive coverage,
Yeah.
but also ensuring the system remains financially viable.
Exactly.
It sounds like careful planning and ongoing monitoring are really essential here.
Absolutely. And that leads us to the third key ingredient,
Okay, what's that?
adaptability and continuous improvement.
Okay.
No healthcare system is perfect.
Right.
And even the most successful ones
Yeah.
require, ongoing evaluation
Hmm.
and adjustments to really meet the evolving needs of the population.
So it's not a set it and forget it kind of system.
Right.
It requires flexibility and a willingness to kind of learn from both the successes
Yes.
and the challenges.
Precisely. A
Mm.
successful universal healthcare system.
Yeah.
It's a living, breathing entity
Okay.
that's constantly evolving and adapting to, new medical advancements,
Right.
changing demographics, and emerging health challenges.
Now, bringing this back to our listener and, their potential retirement in Bermuda.
Right.
How can they use this information to make a more informed decision?
Okay.
What specific questions should they be asking as they're researching Bermuda's healthcare system?
That's a great question. Firstly, they should really investigate how Bermuda's proposed system
I
addresses these, key ingredients for success.
All right.
How strong is their, primary care infrastructure?
Mm-hmm.
What cost control mechanisms are they considering?
Right.
Is there a plan for, ongoing evaluation and improvement?
Okay.
These are all crucial factors to consider.
And beyond those key ingredients, are there any specific aspects of the system that would be particularly relevant for a retiree to focus on?
Absolutely. Retirees have unique healthcare needs.
Right.
So it's important to kind of dig deeper into areas like coverage for pre-existing conditions,
Okay.
access to specialist care, wait times for elective procedures, and long-term care options.
So it's not just about understanding the broad strokes of universal health care.
Right.
It's about delving into those specifics.
Exactly.
And seeing how they align with your individual needs
Yeah,
and your priorities as a retiree.
exactly. And don't be afraid to ask tough questions.
Yeah.
Reach out to healthcare providers in Bermuda,
Mm-hmm.
connect with, expat communities,
Right.
gather as much information as you can
Yeah.
to make a really informed decision.
This has been really insightful. I mean, we've gone from this broad overview of universal health care
Right.
to exploring specific considerations for retirees in Bermuda.
Uh-huh.
But I think there's still one crucial piece of the puzzle we need to address.
And what's
The financial aspects, how do universal healthcare systems,
Right.
like the one being proposed in Bermuda, actually get funded?
Okay.
What are the implications for taxpayers?
Yeah.
And how does it compare to other healthcare models?
Yeah.
I think we really need to unpack that
Sure.
before we can truly understand the full picture. I mean, we've talked a lot about the structure and the potential challenges of universal healthcare, especially for a smaller nation like Bermuda.
Right.
But let's get down to brass tacks.
Okay.
How is all of this going to be paid for?
Right.
Because at the end of the day, government funded really just means funded by the people. Right.
That's the key question. And there's really no one-size-fits-all answer.
Okay.
Funding mechanisms for these universal healthcare systems, they vary widely,
Right.
depending on the country and the specific model being implemented.
Okay. So let's break down some of these common funding models.
Yeah.
I know taxes are often involved,
Right.
but how does that actually work in practice?
Yeah, you're right. Taxation is often a primary source of funding.
Oh.
Some countries will implement a dedicated healthcare tax,
Uh-huh.
similar to that Medicare levy in Australia.
Okay.
Others may increase existing income taxes or introduce new taxes on goods and services
Right.
to generate that revenue for healthcare.
So if our listener were to retire in Bermuda under this universal healthcare system,
Yeah,
it's pretty likely that they would see some changes to their tax burden.
exactly.
It's really essential to factor that into their financial planning.
Absolutely. And it's not just about the overall tax burden,
Okay.
but also how those taxes are actually distributed
Right.
and who ultimately bears the cost.
Right.
Some systems will place a higher tax burden on higher earners,
Mm-hmm.
while others might utilize a more progressive
Yeah.
system
Okay.
where everyone kind of contributes based on their ability to pay.
And what about other funding sources beyond taxes?
Yeah.
Are there any alternative models that countries use?
Yeah, for sure. Some countries utilize a mixed funding model
Okay.
that incorporates both taxation and other revenue streams.
Okay. Interesting. Like what?
For instance, some governments will allocate a portion of their general budget to healthcare
Uh-huh.
or utilize revenue that's generated from natural resources or state-owned enterprises.
So it's not necessarily a case of taxes go up, everything else stays the same.
Right.
It's really about understanding those specific funding mechanisms being proposed in Bermuda
Yeah,
and how they might impact, your overall financial situation as a retiree.
exactly. And it's also worth comparing these funding models
Okay.
to what you're accustomed to in the U.S.
Right.
I mean, while the U.S. doesn't have universal health care,
Right.
it still has, a complex and often expensive healthcare system.
With a mix of private insurance, employer-sponsored plans, and, government programs like Medicare and Medicaid.
Right,
It's
exactly.
essential to weigh, the potential costs and benefits of each system and really see which one aligns best
Yeah,
with your individual needs and financial situation.
precisely.
Yeah.
And it's not just about, the direct costs of healthcare.
Okay.
It's also crucial to consider the potential indirect costs,
Oh, okay.
like lost productivity due to illness,
Mm-hmm.
or the financial burden of, caring for a loved one
Right.
with a chronic condition.
Right.
These factors can significantly impact, your overall well-being
Yeah.
and your financial security, especially in retirement.
So we've covered a lot of ground today.
We have.
We've explored the potential benefits and pitfalls of universal health care.
Right.
We looked at the Australian model as a case study. We considered the unique challenges and opportunities for smaller nations like Bermuda, and then even delved into, these crucial aspects of funding.
Yeah.
But I think the most important takeaway for our listener is this. Knowledge is power.
Absolutely.
Don't let the complexity of this topic kind of overwhelm you. By arming yourself with information, asking the right questions, and carefully evaluating the proposed system in Bermuda, you can really make a well-informed decision
Yes.
that aligns with, your retirement goals and priorities.
Exactly. And remember, you're not alone in this.
Yeah.
There are resources available to help you navigate, this complex landscape.
Absolutely. The Bermuda government website, local healthcare providers,
Right.
expat communities, financial advisors,
Yes.
they can all provide some really valuable insights and support.
And don't forget, we're always here to help you dive deeper
That's right.
into topics that matter to you.
Exactly. So if you have any further questions
Yeah.
or, areas you'd like us to explore further,
Please reach out.
don't hesitate to reach out.
We'd love to hear from you.
This has been The Deep Dive.
Thank you for joining us.
We hope you found this exploration of universal healthcare, informative and empowering.
Yes.
As you continue on your retirement planning journey, just remember, stay curious, stay informed, and always make decisions that prioritize your health and well-being.